Okay, Jenna, it's time for your epidural. All your fluid is in. Pretend like it has been. So your fluid is all in. Anesthesia, just called anesthesia, they're on their way. So what we're gonna do now is we're gonna sit you up, okay? So I want you to actually sit up on the side of the bed. Put your feet over here. Good job. We're gonna get you nice and positioned for your epidural. So this is like one of the most critical parts of getting an epidural is your positioning, okay? Better position you can be in, the quicker the procedure goes, okay? So this is why it's so important. So we're gonna put the bed down. We're gonna get nice and positioned. You're already doing a pretty good job, but I just wanna verbalize this. So you kind of want you to scoot your legs back so your knees are really kind of flush against the bed, right? Good, because I don't want you to be like jumping out of bed or anything, okay? So now what I would probably do is give you a little pillow to hold, because what we want to do is get in that nice position. So I want you to take your hands, put your hands kind of above the pillow. There you go, because I really want you to have like bad posture, okay? So now we're gonna go up in the sky. And by this point, anesthesia is probably in the room with me. Jenna's a pro. She already knows how to get nice and positioned. Sure. She's been through this. If I have an anesthesiologist who's like 5'1", we would probably be going down here. Short king. But there's a lot of guys in anesthesia and they're usually really tall, so we usually have to go all the way up. Yeah, as you can see, Jenna already knows what to do. She's already in a good epidural position. So she's got her arms in front of her like this. I want you to relax your shoulders even more. Good job. Chin to chest. And then this spot right here, I want you to almost feel like you're kind of pushing it. Yep, you want to really poke it out to where and kind of like push against me. There you go. We really want to get in that nice curled position, really like curl around that baby. Perfect. You want to be in this position. Now this position is not super comfortable to be in forever, okay? So I'm gonna let Jenna relax so you can relax and sit up. Good job.
With a big belly, I can't imagine how uncomfortable
It's pretty hard. Yeah, it's pretty hard. So you're gonna be in this position, but like I said, you're in labor, right? So you're having contractions. So you're like, I can't stay still. Okay, so that's why I kind of let you have a little bit of break while anesthesia is kind of getting set up. But here's the most important thing is once we get set up and once he's cleaning you off and starting to numb you, then it's really, really important to be in that nice, still position because that is the most important part. You can't move once they put that needle in your back. We don't want to move, okay? I'm anesthesia. I had you sign a consent form and I explained to you what I was about to be doing and talk to you about the procedure a little bit. I take like a solution and I kind of clean off your back. So we want to get rid of all those germs, okay? Because I'm about to poke you with some things, and so we want to make sure that everything is clean and we don't have any infection, okay? And then we would go ahead and get started. Then I would put on this drape, which is on Mr. Elephant right now. This would tell me kind of where I'm going in your back. So this would also help with infection, okay? Then I would numb you up, okay? And so usually this is what patients say is the worst part of the whole procedure is the numbing medication. And this is not the big giant needle that we've seen on the internet that goes in your back when you get an epidural. This is a little tiny needle, and the reason why it hurts is because it's the medication. It's not even the needle that you're feeling as much as the stinging of the medication, okay? After that, they would place the line, which I don't know where the pump went, but they would place the line for the epidural, okay? And then they would take the needle out of your back and they would say, okay, time to sit up now. You're good. You can move around. The part where you have to stay still is over, okay? We would kind of get you all taped up. It's not immediate, okay? And it usually takes about 10 to 15 minutes to start working. Okay? One of the important things about when you get an epidural, remember we talked about those blood pressure changes, is we don't want to lay flat on your back right after we get an epidural because you've got a big kind of blood vessel in your back. This is the same reason why your doctor tells you not supposed to really sleep on your back, right? Because it can decrease blood flow. Well, same reasoning goes now. We don't want to be laying on our back right after we get an epidural, especially because we can have blood pressure changes. So that's why we're going to be up a little bit, okay? But we're also going to be tilted a little bit to our side, okay? And specifically, you want to tilt to your left side. So I'm going to put this underneath your butt, like a wedge position. Good. You still kind of want to be on your back, but not, there you go. So now we're getting that baby, the uterus, the heavy uterus kind of off of that big blood blood vessel, so it doesn't impact your blood pressure as much, okay? So by this point, yes, we can take off the pull socks, no more pull socks, but we are gonna keep your blood pressure cuff on because like I said, we wanna make sure we're checking that blood pressure every 5 to 10 minutes right after we get that procedure. I would be starting to say, Jenna, are you starting to feel some numbness in your legs? Does that start? Is that starting to feel a little bit weird? Yeah. And how's your contractions? Are you starting to kind of feel your contractions a little bit less? So kind of what starts to happen is your contractions don't go away automatically all of a sudden. What starts to happen is they start to get further and further apart. Like you feel that they, you know, maybe they were happening every 2 to 3 minutes, right? But now they're feeling like they're happening every 3 to 4 minutes. And that's because maybe they're not actually getting further apart, but you're feeling them a lot less. The intensity is a whole lot less, okay? So you probably will still be feeling them and you'll still be feeling the pressure. And one thing that doesn't go away is the pressure of the baby's head, okay? So if you're having contractions, you're still gonna be feeling that pressure of the baby's head, but that pain, the contraction pain that you're having, should completely go away with the epidural. That's what epidurals are designed to do. That's why they work so well, and that's why we give a lot of them, because they work really, really well. How are you feeling? Is your epidural starting to kick in?
Oh yeah, I feel great.
Sweet. Okay, so now as the nurse, what I would be doing is I would be testing, we call it testing her level, okay? So, Jen, I hope you have pants on still.
I do.
Okay. Just to test where the epidural is effective, okay? Because sometimes anesthesia places an epidural, and because of, you know, a bunch of different reasons, right? Your anatomy or you know, how much of the medication you got. It can be one-sided or it can be kind of uneven, okay? So 5 to 10 minutes after the procedure, I'm starting to test the patient's level, okay? So one thing that happens when you get an epidural is not only takes care of your pain relief, but it also takes away your ability to feel temperature, okay? So if I were to take a big hot iron poker and go like this, you wouldn't feel it at all. Isn't that crazy?
Ow.
But we don't use iron pokers, we use ice. Okay, so I would take a piece of ice or like a cold alcohol wipe. All right, so we're gonna test the patient's level now with some fake ice that I have, okay? So what I would do first is I would say, hey Jen, does that feel cold? Ooh, that's cold, yes. I wouldn't put it up there. So I'd say, yes, that's cold. And then we would test to see how far you can feel cold, okay? So I'd say, Jen, does it feel cold down here?
No.
No? Okay, how about up here?
No.
Right? I wouldn't do it through the gown. Sorry, that's unrealistic. That's silly. So I would do it up here, right? You probably still wouldn't be feeling it up here. I would keep going up here, right? I would kind of feel around your hip. Probably still no.
Don't feel it.
We want it to be about like right here, okay? So usually between like your belly button and your nipple line, you'd be starting to feel that cold sensation, okay? So I'd go kind of up here and you say, maybe I feel it, right? And you'd say, okay, I definitely feel it up there, okay? So then I would kind of mark that. You can even mark it with a pen or just, you know, you usually just remember, oh, okay, it's about right there, okay? So I'm gonna go on the other side and say, okay, boop, 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 boop. Okay, Jen, how's it feel down here? Anything?
Feels good. No.
You feel nothing? Okay, no
Nothing.
cold. So I'm gonna do the same thing on this side. And I would make sure that it's about the same spot, okay? Because sometimes what happens, especially because we've been on our side right now for a little while, that medication might have gotten a little bit more on this side than this side, okay? So let's say she's like, oh yeah, I'm starting to feel cold down here. Then I would say, oh, okay, that's my indication that it's time to kind of turn you a little bit so that medicine kind of eases, you know, kind of, what's the right word? What?
Levels out.
Levels out. Thank you. Evens out. Once you're nice and numb from your epidural, we would place that Foley catheter, and then I would sit you back up. And by this time, you're probably talking with me, you're laughing with your partner, you're just a different human being altogether because you have your epidural and you are just, you're good. Life is good. So yeah, I think
Ready to take a nap.
I think that's it. Thank you for watching.